what about prescription drugs? I know the Biden administration's been making a lot of noise about the drug price negotiation. Has that come online yet? And what sort of effect is that going to have on Medicare?
Well, no, the first changes actually won't be implemented until 2026 in terms of actual pricing going into effect. However, they plan to announce some of the effects of the initial negotiations for the first 10 drugs selected this September. So they wanted to get out in front and say, hey, folks, we're going to start reducing the pricing for these 10 drugs relative to what otherwise would have been paid in January 2026. They'll announce what those prices are in September. At least that's the current schedule. Look, this is an very important shift in policy. It does bring the government for the first time directly into negotiations. And, we put that into some quotations sometimes with the manufacturers around the pricing, because the government, of course, has a very strong leverage in this, which is if if the manufacturer doesn't agree to what the government says ought to be the price, they can essentially get rid of the entire ability to sell the drug, taking 95% of any revenue. So, the penalty for not participating is so high that, you're going to have some, drug companies saying, hey, the leverage situation it's not a real negotiation. So we'll see how that plays out, but nonetheless, it's a new thing, and it could effectively, there's no doubt that if the government, the biggest player in the national economy, comes in and says, hey, we want to lower the prices for these 10 drugs, they're going to lower the prices for these 10 drugs. The government's big enough to take care of itself.
Now, of course, lower prices sound good if you're a consumer, but the drug companies point out that if you squeeze all the profit out of making making drugs, that you're going to get fewer new drugs in the future. I mean, is that a valid criticism or complaint?
This is absolutely valid. The question is degree. I mean, even the Congressional Budget Office has done an assessment of this and said that's going to happen. There's going to be, because you have potentially reduced the returns on patents, which is investigative research into new products, which, let's be honest, they create monopoly situations. It's under our Constitution that's allowable for a period of time. Question is how long you're allowed to do it, and then what happens, kind of afterwards with generics. But the truth is that in a monopoly situation, if the government can come in and reduce the pricing, of course, that's good for the consumers, but it might mean that someone doesn't do the research. CBO says that's going to occur, but the manufacturers say that CBO is vastly underestimated how many new drugs are going to be lost because of this. They think the number is going to be much bigger than CBO said. It was a dozen or something like that. I don't remember the exact number that CBO said, but it's not a huge number. And the drug companies say, the risk is much higher.